SMX medical update. We bring in the good doctor, Dr. Joe McGinley, always helping out with the privateer support program and helping us on our show. Rider that needed help from the Alpine Stars mobile medic over the weekend was Casey Cochran. I thought he was holding his wrist, but he was actually, I guess, trying to hold his shoulder from getting worse. It has been confirmed he dislocated his shoulder, and it looked like the trackside medics were trying to help get that back in. So just talk about shoulder dislocations.
Yeah, it's fairly common in motocross. We've seen it a few times now this year. Just for, the audience's information, it is the most common dislocation in the body, an anterior shoulder dislocation. And let's talk about the anatomy and how this actually happens. So your shoulder, it's actually complex anatomy. It allows you to move your arm in any direction, but really at the base of it, it's a ball and socket joint. So what holds that in place is a labrum, and think about it like a gasket holding it in place. Now, to keep it stable, there's also ligaments, and they're, wouldn't necessarily say the bolts of the area there, but, tension cords on that joint to keep it in place. And then the rotator cuff, finally, that allows the motion. So when you have a dislocation, oftentimes the rotator cuff's not injured, but it's more that labrum, that gasket, and those ligaments that stabilize the shoulder. So when it pops out, those can get torn and get injured. Now, depending on how bad that is, you can also have small fractures, injuries of other structures, but that's what determines if a rider could, take a few weeks off and get back at it, or if they need surgery. Oftentimes, if you have multiple dislocations, that's where you really start to damage those structures. That's where they really do head down the surgical route as far as recovery goes. So not all shoulder dislocations are the same. The MRI is critical for diagnosis of that. Keys early on we saw at the track is getting that relocated as quickly as possible. I read online they were able to get that right back in, so that's good. But you have to make sure the other tissues aren't damaged after that. So that's the purpose of the MRI that I'm sure he's undergoing this week.
So when you think about that, getting the MRI and, it takes varying amounts of time to get those results back, what will dictate as far as whether, because we've seen riders return in a week, and then we've seen other riders have to undergo some sort of procedure and they're out for multiple months on end. What will be the deciding factor there when whoever's reviewing that MRI gets results?
Yeah, best case scenario, there's no major tears of the ligaments. Maybe they strained a ligament, maybe a small labral tear. That's going to be best case scenario. On the more severe side of things, you can have chip fractures of the bone, injuries to the bone. You can tear a large portion of the labrum. You can completely tear the ligaments. Then it becomes unstable. That's when they need surgery. So, there's a wide range as far as what that looks like.
What's some stuff that could be done? Yeah, multiple times you're probably going to have to go in for surgery. But if it was early, what can they do to avoid the surgery?
Yeah, oftentimes in our clinic, we're using cell therapy quite a bit for this particular problem, both in the hip and the shoulder. So with cell therapy, you'll go in and target the areas that are torn. So the assumption is it's a partial tear, not a complete tear. So if you have a partial strain of a ligament or a stretch of a ligament, or if the labrum has a small tear in it, you can go in with either PRP and stem cells, and that'll help heal that tissue. So you're using the body's own healing response. Just if you like you had a broken bone or cut on your skin, your body will fix those damaged areas. We're just facilitating that inside the joint by putting the same cells directly where the abnormality is, and then the body does its thing and helps to heal those tissues.
Yeah, sometimes the best surgery is no surgery. Wow, you don't often hear doctors say that. I have a good buddy named Phil Nicoletti that says they're always going to recommend surgery because they make more money that way. Not everybody, so good for you. And we wish you the best, Casey Cochran, and we'll see you at the races soon. See you at Washougal in a few weeks.